All right, moving on now to our top focus as far as the coronavirus situation across the country is concerned. Now, India's COVID battle is far from over. More and more states are reporting a rise in cases. What started off with just Kerala and then Maharashtra, now it has further spread to Chhattisgarh, Punjab, Madhya Pradesh, Jammu and Kashmir. 4 more states witnessing a surge. They are Bengal, Tamil Nadu, Gujarat and Karnataka. In response to the surge, the centre has rushed an expert team who will go to all of these states and provide a targeted COVID response. In addition to this, the centre has also written to 6 states that includes Maharashtra, Kerala, Gujarat, Punjab, Chhattisgarh and the Union Territory of Jammu and Kashmir, advising specific measures that need to be taken in the backdrop of decreasing RT-PCR testing and a rise in the positivity in some areas. Those are the latest details coming in at this point in time as far as the COVID spread is concerned. Ayushman is joining us for more details. Ayushman, if you can take us through, what the latest developments are, because this is now, it started off with just Kerala and then Maharashtra, and now it seems to have spread to many more states which are registering a rise in the number of cases.
If you see in the current situation, the centre has written to the states that there should be no complacency in the containment measures. Otherwise, the new mutant strains which have been detected, like we have seen in the Western countries, situation may deteriorate. And that is why in 10 states now, the teams are going in to 7 states. The centre, the Union Health Secretary has written and said that the teams which are going right now, they will be interacting, they'll be giving their observation to the Principal Health Secretary and also to the Chief Secretary as to what are the new measures that should be taken. And like you pointed out, Avni, it started from Maharashtra and Kerala and then it went on to 5 states. We are in Delhi right now, where Delhi government is to issue an order where 5 states have been marked from where people, if they are coming, they need to bring the negative COVID report, and this is being contemplated in other states also. So the declining trend of COVID, which we were witnessing for past over 1 month, now seems to have gathered pace in increasing trend in some of the states, and now the centre has clearly identified 10 states are there, and Union Territory of Jammu and Kashmir is also included there, where the numbers have slowly and steadily gone up, and now the centre has sent teams and has also been communicating that containment measure of test, track and treat needs to be followed. All those tests which are coming negative in antigen need to be followed up with the RT-PCR, and testing numbers need to be increased. Now, how much of this will be replicated on ground, how much of the states will increase the testing, that remains to be seen. But for now, the number of states have increased which are currently facing an increased trend of new COVID cases.
Yes, absolutely, Ayushman. Extremely important issues now that need to be dealt with. But please stay with us. There are also a lot more developments in terms of what states have been doing, the kind of travel restrictions that are now coming back after all being lifted. Many states are specifically putting in place new rules meant for people traveling from some of these high caseload states such as Maharashtra, Kerala, Chhattisgarh, Madhya Pradesh and Punjab, which are at the center of the rising COVID cases. Ayushman, if you can take us through what exactly are the latest developments in terms of all of these travel curbs here and what really states are doing.
Well, you see, Avni, all the states, be it Karnataka, Gujarat or the national capital, they are on their end. They feel that the cases have declined in their cities and the state, and they need to maintain this scenario. Now, how it can be maintained? If you can actually put a curb or completely close down the borders, you can obviously not allow people coming in, but that is not going to help. So, if you are allowing people, then the certainty must be there that all those people who are coming with, they are actually having a negative COVID report, and that should be RT-PCR. And that is why the focus now is shifting towards having a negative RT-PCR report. Only then the states are saying that the people who are coming, like in national capital, we were talking about anybody coming from 26th Feb midnight to March 16, we are being told, will be needing negative COVID-19 certificate to be produced at the airport, railway station and also bus stops if he wants to come from 5 states which are currently Madhya Pradesh, Chhattisgarh, Punjab, Kerala and Maharashtra. So states on their own are putting curb. But the point is right now that the current headache that the center has right now is that earlier, which was only 2 states which was witnessing the increased trend, now the number is somewhere, earlier it was 5, now it has gone to 10. So 10 places in India are witnessing an increased number of COVID, which is really something to be really be worried of. And that's why you're seeing increased movements of teams, increased dialogues between center and state, and now we are being told that center has also said that the states need to increase the containment measure so that the number of active cases coming from these states can come down.
All right, Ayushman, thank you so much for joining us with all of those details.